Good morning. It's a pleasure to be here and follow up on Jack's very energetic and I think motivational talk about innovation. I'd like to share with you some of the experiences that we had at Biodesign at Stanford in implementing a program like this that meets all of those needs of clinical need identification, a team-based approach, and a very active involvement of the community. And Biodesign has been in existence since 10 years. So a lot of learning, and we're continuing to learn and continuing to improve the system and our educational structure. Biodesign is part of the BioX Center at Stanford, which is a center that is in existence since 10 years that brings together various disciplines, and you have bioinformatics in there, you have biomedical engineering in there, but also biodesign, which again is this innovation-oriented group that brings together medical doctors, engineers, life science specialists from chemistry, physics, and also people from the law school and business school. Our mission is to develop leaders in biomedical technology innovation, and our mantra is educate, collaborate, and innovate. And I saw this morning that the Irish mantra will be educate, innovate, and collaborate. So it's going to be interesting to compare in a couple of years. A few words about our structure. You see that our leadership actually in the program is part of the medical school primarily. Paul Yock is an interventional cardiologist who has been a very successful inventor in addition to his clinical career. He invented the rapid exchange catheter, which is in use worldwide for balloon angioplasties. He's also invented intravascular ultrasound. And he was actually the driving force in creating this program when he came to Stanford. The other co-director is Dr. Tom Crummell, who is the head of surgery and head of pediatric surgery at Stanford. We have a tech transfer function with Ari Cheney, an experienced industry person who joined us 2 years ago, who was the co-author of the paper that Jack Linehan talked about earlier about the translational efforts in the United States. We have a core faculty group. Craig Milroy is in charge of the collaboratory, which is a space where people can rapidly prototype and test their ideas out. I'm in charge of regulatory and tech assessment. Professor Richard Popp is in charge of ethics and policy. He's also a doctor of medicine. Paul Wang is an electrophysiology expert, setting the efforts in electrophysiology at Stanford. And then Stefanos Zinios from the business school, who was the lead author of the biodesign textbook, which you may have seen already, which is describing the process from the very early stage of needs identification all the way through commercialization. Then we have the key element of the program, which is the fellowship program, which is headed by Josh Meckauer, who was this co-inventor that Jack mentioned of Acclarent. Very long experience actually in starting these types of programs. He came from Pfizer, where he led the innovation group, and then was critical in starting the fellowship together with Paul Yock 10 years ago. Todd Brinton is currently the fellowship director, and then interestingly enough, we have a shrink, as we say in the US, a psychologist who is also working with the teams and making sure they don't fall apart. Then an advisory faculty group, Tom Andriaki of mechanical engineering, Scott Dell, Jeff Gertner, who is a surgeon, Jack Linehan, Tina Seelig, but you see it's really faculty from all across the university working closely together. We have weekly faculty or leadership group meetings, so it's a very integrated approach. A couple of years ago, we started global programs. I'm going to say a few words about our global programs in a minute. We have an active collaboration with India, with the All Institute of Medicine in India, Stanford India Biodesign Program, and since last year we have a program with Singapore, the Singapore Stanford Biodesign Program, and those are really our main global efforts and foci, and it's actually a lot of work, so hopefully at some point we can add another program, but for now this is our focus. The idea of the fellowship is to really bring together people from various disciplines and have them spend a year together closely working on needs identification, then in inventing technologies and implementing them. And it's in all of the teams, in every year, it's intentionally a background that is really widespread, background in medicine, as I mentioned, engineering, MBA type backgrounds. You see the 2009-10 fellows, just to give you an idea of the teams, we have 2 teams of 4. And you see PhD, masters, MBA backgrounds, medical doctor on that team. Similar structure in the white team. The process is that we identify, or we have our call for applications out, roughly 200 applicants. We invite 20 and have a 2 or 3 day interview process, and finally end up with 8 people that we feel would work well together and bring the qualifications and background. Some of them, by the way, have spent some time in industry before coming back to the program. And they start with a 2-month period of clinical immersion. So the hospital, we always choose one specialty. In a year it could be cardiology, in the next year it could be gastroenterology, and they spend 2 months every day at the hospital and observe what is happening, talking to people, but just also observing and identifying issues and problems. And that's important because we asked them to identify at least 200 needs in those 2 months. And so the next process step for them then is to prioritize those needs, analyze them, and boil them down to a set of maybe 5 or 10 needs, which they then take further, analyze in further detail, and then they start with the invention process. So it's not a technology solution looking for a clinical application, it's really the other way around. It's a clinical problem identification, and then the invention process starts. And there are several ways of looking at needs or selecting them. One of the teams actually has developed a comprehensive computer-based evaluation that is now being used, but it's really up to the fellows and the teams to decide how they want to do it. And we do have, in terms of structure, we do have a brainstorming room that for the invention phase is really important. We have white walls all around, people can write. There are all kinds of tools for rapid prototyping that they can readily implement and use. And one of the fellows said, give me enough time, sugar and caffeine, and you will invent something eventually. But it's an intensive process. This process of identifying the need, inventing and implementing is outlined, as I said, in the biodesign book, which, again, some of you will already have seen. It's available on Amazon, also in Europe, if you're interested in looking at it. In addition to the fellowship, we do have a number of classes. The core class is the Biodesign Innovation class, which is a 2-quarter course, so 2 times 10 weeks, and it's open to students from all across the university, oftentimes master's students, a couple of PhD, a couple of undergrads. Class size roughly 70, and it's mentored by the fellows, so they're kind of teaching assistants to the students and the project work that they do. We also have very active involvement by the community, so a lot of industry people come in and teach and share their experience, venture capital people, so it's really a team effort, not only within the university, but also with the surrounding industry. In the 10 years, we had about, well, more than, I think by now it's 20 companies that were started out of the program, with more than, by now it's, I think, 25 or 35,000 patients treated with these products. But we think this is not the main outcome or objective of the program. It's really, our real product is really the young people, innovators that then go out and either go to start small companies, go into academia, spread the word, multiply the effort, or go to large companies. And every year we invite them back for the graduation of the current fellow teams, and it's really a strong community and strong bonding with a lot of learning opportunities. Since last year, actually, there's an alumni group, and they continue to meet and educate themselves and exchange ideas. In addition to our core programs, we also have collaborations with the Food and Drug Administration in the US. We send a couple of people that have interest in learning about the government's efforts in evaluating products and allowing them to market to the FDA. It's a 6-month or 1-year fellowship, and last year I think we had 4 people spending time at the agency, and they found it very useful, and the agency did as well. Another program that we have implemented is the emerging entrepreneurs, the idea of not only teaching within the university but also creating opportunities for outside industry people. and we've implemented it twice. I think 2005 was the first year, and then 2008 again. Roughly 200 people coming to that program. It's a 2.5 day weekend program with very active participation and instruction by medical device experts from the community. So it's again creating this community, bringing together people, exchanging ideas, learning from each other. We also have a certificate program in biodesign which is available online to people around the world. They can sign up and take our innovation course, also a patenting course, and the tech assessment course. As I briefly mentioned, we started these international programs, India Biodesign and the Singapore Biodesign program, and one of the key missions really was to create opportunities in these emerging countries for affordable innovation, and so bring the skills of needs finding to other markets where there may be different, or definitely are different needs, and to addressing them. And we think that all of our markets in Ireland, Europe, in the US actually can learn a lot from these efforts in the future and bring back smarter and more cost-effective solutions to our healthcare systems. And so the focus, again, is Delhi and Singapore. The India program has been in existence since 3 years, and the idea is that fellows are selected in India, spend half a year at Stanford, learn the initial process, then go back to India, do the needs finding there, and spend another 1.5 years in their institutions in India. The All Institute of Medicine and IIT are the partners. This is one of the affordable solutions, actually was captured in Time magazine as one of the 50 best inventions of the year. And it was a very simple solution, a very simple solution for amputees. So it's a prosthetic that costs about $20. And it's built on oil-based nylon, very flexible and works very well. So that was a low-cost solution with high impact for that region. Stanford Singapore Biodesign, again, as I mentioned, has been up since last year. The idea is to also create a channel into the Chinese market, which is a rapidly growing market, and learn about that market. The same idea, 4 fellows from Singapore are now at Stanford and learn the initial process and then go back to Singapore. And it's really creating a network globally also. Corporate partners have been very important for Stanford and for the success of the program. You see some of the major medtech companies that have put not insignificant amounts of funding into the program. The program, by the way, is fully self-funded, so it was all based on fundraising efforts of biodesign. The university contributes the space, but most of the program expenses are actually covered by fundraising activities. And you may have seen that all of the fellows have named fellowships. So a lot of successful medical technology innovators have contributed funding for one fellow, and so it's the named fellowship then for that person. And the venture capital industry is also actively involved through funding, but also through mentoring and meeting with the students and providing training and opportunities to engage and learn from each other. So we're really glad to see this excitement in Ireland and the great start with the 5 universities, which I think is the first time worldwide that an effort is undertaken where it's not just within a university but within a network of universities. And so that should be a tremendous success, and where we can, we look forward to supporting you and wish you all the best. Thank you for coming this morning.